everyone. Welcome to Gracefully Graying. We invite you to our YouTube channel, searching Gracefully Graying, and also going on gracefullygraying.com to search and take in all of the content that we post nearly daily. Today, we are excited to have Dr. Jeffrey Guina, who is the Chief Medical Officer of Easterseals and also the Psychiatry Training Director at Beaumont Health. So welcome, Jeffrey. It's so nice to have you.
Thank you.
First of all, tell us a little bit about your background, if you would.
Sure. I am from Michigan originally. I went to medical school at Wayne State University. And then I was in the Air Force for 10 years. I was an active duty psychiatrist. I ran a alcohol and drug program for the military for a while. And in addition to psychiatry, got board certified in addiction medicine. And then I served as mental health medical director over consulting with several bases across multiple states and multiple branches. During that time, I got really interested in doing forensic evaluations, high-risk evaluations for pilots and people working with nuclear or biological material, and doing criminal evaluations. And so that led me back to University of Michigan, where I did a forensic psychiatry fellowship. And then I started working for the state of Michigan doing court evaluations and expert witness testimony and treating people who were found not guilty by reason of insanity at the high security hospital in Saline, Michigan, among other things. Then I got really interested in public mental health and did a fellowship at Wayne State. And that led me to work with Easterseals, which is Michigan's largest community mental health provider. So we have locations all over the state and treat kids and adults with physical and mental disabilities, and providing psychiatry, psychotherapy, case management, and a variety of services for things like autism, things like schizophrenia, depression, anxiety, trauma, and as well as have specialized services for seniors. And then I got lucky enough to, if that wasn't a good enough dream job, I got lucky.
Right, like that wasn't enough already, right?
I got approached by Beaumont to help build their new psychiatry training program. And so Beaumont's the biggest healthcare provider in Michigan. And so that will be the main inpatient training site for new psychiatrists. And Easterseals will be the main outpatient training site for new psychiatrists. And so I'm really excited that I get to lead that program. I really enjoy education, and I think it will be beneficial for the community in helping with the psychiatry shortage that's out there.
Wow. Okay. Well, that's a really interesting fit. Thanks for explaining that. And wow, you've done a lot. That's what I can say. So it's very impressive, and we're really glad to have you talk to us about this. So I'm going to jump right in, given that we are in huge throes of coronavirus. What are the huge increases in stresses in your professional opinion related to the coronavirus?
Sure. So I think the obvious stresses are kind of the direct things from the virus itself, right? People are afraid, so there's fear. There's grief. About 6% of Americans know somebody who's died from COVID. But I think as a psychiatrist and as an addiction medicine physician, I tend to worry mostly about the indirect effects of the virus and the shutdowns themselves. So there's a lot of isolation, and there's a lot of stress related to financial problems, people losing their jobs, people losing their businesses, trying to live paycheck to paycheck. There's kids who are taken out of their normal day-to-day life with school and sports and activities, and then parents having to figure out how to make ends meet and supervise their kids doing school. And so there's just, I think there's a lot of stress, things that that it's really disrupted life for everybody across regardless of what your situation and or background is.
So with that, you have undoubtedly seen increases in alcohol and drug abuse.
Absolutely. So it's estimated that during COVID, about 15% of people have either started or increased their use of drugs or alcohol. And there's been a 42% increase in overdoses.
Oh.
And many of those resulting in death from a variety of drugs and alcohol. And so I think, I worry that when healthy activities are kind of taken away from people and there's limitations in going to school, going to work, going to church, yet things like liquor stores are open, then unfortunately, then there's more access to kind of the unhealthy coping skills than are to healthy outlets.
Mm-hmm. Actually, that's really very interesting. I've never really heard anyone put it that way in the last 9 months. So that's an interesting point. So what would you suggest are healthy coping skills then, given this horrible time right now?
Right. Well, the way I think of coping skills is I kind of imagine a list, and we all have this list. We might not necessarily be conscious of it exactly, but there's this list of what we kind of naturally go to when we're under stress. And that list has healthy and unhealthy coping skills on it. And when the first thing doesn't work, we go to the next thing. And when that doesn't work, we go to the next thing. And, on that list, for all of us, things like drugs, alcohol, suicide appear somewhere on that list. For me, it might be number 3. For you, it might be number 1,000, but it's somewhere on that list. And unfortunately, when healthy coping skills and healthy outlets are kind of taken away, those unhealthy coping mechanisms move up the list. So healthy things would be like, spending time with your friends, reaching out to a loved one and talking to them about your troubles, going to church, going to the gym, working out. So obviously there's a lot of limitations on all of those things during this time. And so maybe you can't go to the gym, but maybe you can try to exercise at home. And during the summer, that was easier, taking a walk outside. And as it's
right, but it takes a lot of discipline right now when you're inside.
It does take a lot of discipline, yeah. And so I think we have to be mindful that there's limitations, but try to find workarounds. With being social, for example, maybe you can't go to a restaurant right now and see your friends and do other kind of gatherings and parties that you're used to. But right now, I don't really like the term social distancing because like right now we are physically distant, but we're able to be social. I'm able to see your face, hear your voice.
Right. So, that was my next question. Why is that a bad term? Explain that.
Yeah, because I think you're able to be social even when we're apart. And fortunately in a time where we have technology that allows us to do that. And so with we're on Zoom currently, there's other systems, Teams and FaceTime and all kinds of other ways that we can see each other's face. And because isolation is such a big driver of depression and anxiety right now during this time, I think it's important now more than ever that we take that opportunity to try to see each other's face, hear each other's voice as much as possible. Whereas maybe in the past, we might have connected more by email or text. Maybe right now is more important that we pick up the phone and we hear each other's voices. It's more important that we set up video chats with our loved ones and on a regular basis and see them. I've heard about people doing virtual game nights and playing games over the video. And so I think those are ways to try to stay connected as possible during these restrictions.
Yeah. What about spikes in child abuse and domestic violence?
Yes. So, when I first heard about the shutdowns, back in March and we started, my first thought was, about domestic violence and child abuse. That was my first fear, because we know that when people are under stress, that those things go up, that violence and aggression goes up because people are under stress. And because people are kind of trapped together, families are trapped together, they're going to get on each other's nerves more, they're going to be more irritable, and they're not going to have to be able to have breaks from each other. And so under normal circumstances, we miss a lot of domestic violence and child abuse. Even when kids are going to school and teachers have the opportunity to notice bruises or notice injuries or notice that they're just not acting like themselves. But in these circumstances, where kids are at home all the time, spouses are at home all the time together, and they're under stress, I worry that it's like a boiling pot. And we know from emergency dispatch calls and emergency room visits that violence is up, that child abuse is up, that domestic violence is up. And I worry that it's not getting caught as often as it normally would, because those social services, those outside activities outside the home aren't there as much to catch this. And I worry about the long-term impacts of this and how it's going to affect those kids and those adults for years to come.
Yeah, and you would call those trauma stressors? Tell us the definition of that.
Sure. So there's traumas and there's stressors. So and people have different kinds of definitions of what constitutes a trauma. A trauma would be kind of a very severe stressor that has a lasting impact. So examples of trauma might be physical abuse, sexual abuse, rape, combat, domestic violence, being in a natural disaster, those sorts of things. But of course, there's all kinds of other stressors as well that can have significant impact on people. So losing your job, divorce, witnessing violence that maybe didn't happen to you, but you're seeing going on around you. Emotional abuse, people constantly calling you a name, constantly putting you down. And so isolation, like I mentioned, grief. So those things might not necessarily be traumatic. They might not involve fearing for your life, but they can still have a significant impact on your emotional and physical well-being.
Right. And so speaking of that, what do you mean by the body keeps score? I mean, I think I have an idea, but go ahead and explain that.
So The Body Keeps the Score is a great book that was written by Bessel van der Kolk, and it's an excellent read for people who are interested in it. And what he talks about is the biological, psychological, and the social causes and effects of trauma. And so people, I think, when they think about traumas, they think, okay, well, it's short term, that happened to me or that happened to someone else, so now it's time to get over it. Well, we know now from a variety of studies of the brain, of brain scans, studies of hormone changes, studies of that are related to neurology, endocrinology, immune systems, that trauma can have long-lasting impact that lasts years and sometimes the rest of people's lives. And this is particularly true of child abuse. So kids who experience physical, sexual, and emotional abuse have changes in their immune system, have changes in their growth hormone levels, and those things can change their bodies and change their minds for the rest of their life. And we see changes in brain scans of the size and function of different areas of the brain, especially those that have to do with thinking, that have to do with controlling your behavior. And that's why sometimes we see people who've been through trauma, particularly early trauma and particularly repeated trauma, they're more reactive. Maybe they get angrier quicker. Maybe that trauma continues to intrude on their present life, where they're constantly thinking about it. They're constantly feeling like they're back in that trauma. Or sometimes they're just numbed out and they just feel totally numb and unable to enjoy things they would normally enjoy or feel pleasure. And fortunately, even though trauma can have a long-lasting impact on people, we also know that having healthy relationships can repair that and change that and improve your brain chemistry and brain functioning. And so that you can live a healthy, normal life. So that could be good romantic relationships, that could be good friendships and trusting relationships. It could also be like a therapeutic professional relationship, going to therapy, talking to somebody, and processing what you've gone through. Can literally, those words can change your brain.
Right. And so how about the effects of trauma on the elderly or, the older audience?
Absolutely. So I think I talked about isolation, and I think people who's maybe empty nesters, their kids are out of the home now. They may have lost loved ones, lost their spouse. They're at particular risk for social isolation. And we as human beings, we crave connection with other people. And so that loss of connection and decreased connection with people can have a long-lasting impact. All the things I just said on our bodies, our minds, our feelings, our behaviors. And so that's why I think it's so important that we take advantage of the technology we have, whether it's phones, whether it's computers, to try to stay connected in any way we possibly can.
Right. In fact, our last guest was Gina's Connect, the app that does exactly that. So there is that technology out there and it's continuing to come out. So yeah, that makes sense. And that the importance of that. What about productive disagreement? Tell us what that is.
So, during this time, there's just so much conflict that's been going on in 2020, whether it's political because of an election year or whether it's because of COVID and policies related to COVID. And so you see out there on the news and videos of people screaming at each other in grocery stores and protests, getting in fights, arguing about masks, arguing about whether schools should be open or not. And I think one of my big concerns is that it's almost as if we've lost our ability to disagree with each other. And I think we have to relearn how to disagree with each other rather than hate each other. The truth is most people have good intentions. Most people want everybody to be safe, and they want everybody to have a job, and they want everyone to be happy. And when people are disagreeing, usually they often have a good point. There is danger in opening schools and exposing kids to the virus. There's also danger in not opening schools and kids being not developing, not learning the things they need to learn, not engaging in social activities. And unfortunately, we're seeing suicides and overdoses spike, not just with adults, but with kids. And so people have a point on all sides. And I think we have to try to do a better job of hearing that out and productively disagreeing so that we can acknowledge that there's no 100% right answer. We're all just trying to do the best we can and weigh the pros and cons or weigh the risks and benefits of all the decisions we're making. And my hope is that that over time we can get back to a place where we can productively disagree instead of, like I said, just hating each other and yelling at each other and constantly assuming the other person is evil or wrong because they disagree with us.
Yeah, it's so prevalent right now. So what if, for our viewers, I mean, if you have somebody in your family, if you have a friend who is, what are some signs to look for, I guess is what I'm asking. Like what should people be looking for, and then they need to get help, or you need to help them get help?
Sure. I think stress can manifest differently in all of us. So, my signs of distress might be different than your signs of distress. but I usually think about things as being kind of in three buckets. It's emotional, how we feel. It's our physical signs and how we physically feel, and it's our behavior, how we're acting. And so the physical signs are if you or other people are having increased pain. It could be headaches, backaches. We know that stress can cause and it can increase pre-existing pain. If you're having trouble sleeping, your sleep could be either going up or down. You're sleeping way more than usual, or you're sleeping way less than usual because you're up all night anxious, or you just wake up in the middle of the night and you just can't get back to sleep. Those could be signs of stress. Appetite could increase or it could decrease, and that could be a sign of stress. Behaviorally, people may be more irritable, more aggressive, more agitated. They may be much more reactive when things happen. Even smaller stresses might set them off as if it was a bigger stress and kind of seem disproportional.
And sometimes people don't know if they're doing that, right? Like they don't realize unless somebody, if somebody's observing that, but.
Right. Yeah, and that's a hard conversation to have, right? Because if someone's already irritable, pointing that out might make them more defensive, right? And so I think when you're noticing signs like I've been talking about where people's behaviors are changing or they're being more irritable or they're being more withdrawn or any of these things, I think my best advice is trying to approach them from a prism of helping, not of attacking them or impugning their motivations or that we recognize that when someone's acting like that, it's probably because they're struggling. And hopefully we can have empathy for that because we've all struggled. We've all gone through difficulties and we all have bad days or bad weeks or sometimes bad years. And so trying to talk about directly about, I'm worried about you, rather than you're doing this, I don't like this, just starting from, I'm worried about you, you seem different. You see, and then maybe that might open up and lower their defenses a little bit so you can talk directly about what you're seeing. The other thing I would say is people are often afraid to ask about suicide. There's almost this idea that if I ask someone if they're thinking about suicide, then that's going to plant an idea in their head. They're going to be more likely to do it. And we know from many studies that asking people directly about suicide actually decreases the risk of them killing themselves rather than increases it. And sometimes you might be the one and only person who asks. Other people might have been worried and might thought about it, but you think that you might be the only person that's asking, and that might be giving them the only opportunity they've had to talk about it and to get an outlet. And sometimes just asking, I'm worried about you. Have you been thinking of hurting yourself at all? And talked with them about that. And just talking about it and just having someone willing to listen and understand what they're going through could go a long way to help them. And if you're very worried about that, especially that they're imminently going to do something to hurt themselves, there's resources. There's suicide hotlines. Many suicide hotlines out there and emotional distress hotlines. And in fact, during COVID, the calls to those hotlines have gone up 1,000%. You can also take people to emergency rooms or crisis centers. Every community has one. And if you really think someone's going to hurt themselves and they're unwilling to go themselves, as a last resort, you can call 911 and police can take them to an emergency room. It might just save their life.
Wow, 1,000%. That's quite a statistic. Yeah. And this, obviously this could affect anybody, any age. What about the impact or how about protecting older people? Our demographic for Gracefully Graying is 50 and over, but that's a whole range of ages, obviously 50 and over. Obviously this can affect any age, but explain that. I mean, in the elderly community where you talk about isolation and loneliness and, getting to a point where somebody really needs help?
Well, even pre-COVID, the risk of suicide goes up with age. So the age of people most likely to die by suicide, unfortunately, are our seniors. And
that's so you don't really hear about that so much, do you? You hear maybe younger people.
Right. I think people tend to pay a lot of attention when it's someone that's very young. And unfortunately, we are seeing big increases in suicide rates among young people. But actually, the older you are, the more likely you are to die by suicide. And you're right, it doesn't get spoken about that often.
Right.
So we know that during COVID, just across the country, 11% of people, so over 1 in 10 people, have seriously thought about suicide. And it's estimated that here in Michigan, a study was done that estimates that the rate has increased about 25%. So I am greatly worried about the effects that the COVID and the shutdowns have had on seniors, because one, we know that the risk of COVID goes up. The risk of getting COVID and the risk of dying from COVID goes up with age. So the older you are, probably the more likely you are to want to isolate yourself, to protect yourself from the virus. And then that's when it becomes even more important to try to not be socially isolated, even if you're physically isolated. Because I think that is one of the big drivers of suicide during this time, unfortunately, isolation.
So your part specifically with Easterseals, tell us about how people can get help.
Sure. Easterseals, Michigan, our phone number is 1-800-75-SEALS, SEALS. And as I mentioned, we treat and take care of people and provide services across the lifespan. And prior to COVID, we were pretty much doing all in-person services, both in our clinic and both going out to people's homes and even schools. During COVID, we had to rapidly transition to doing telehealth. And we had been doing some telehealth, but at one point we were doing 100% telehealth, meaning that over your phone, over your computer, we were doing all of our appointments. At this point, we're doing a mix. So whatever people want and what they need, we're willing to work with them to do in person or to do telehealth. But fortunately, we've been able to receive a lot of donations and grants, and that has allowed us to purchase hundreds of devices and data plans, and get those devices, get like tablet computers out to people who don't have technology, or maybe don't have, even if they do, they don't have the data plan. Or even for those people who have all of that, we've been trying to train people on using these devices so that they can stay connected to our services and get the help they need, whether it's therapy services or medication services or group therapies. We help people with housing and employment and those sorts of things, but also so they can use those devices to stay connected to their loved ones. And just like we're doing now, and talk to their family, talk to their friends, and try to stay connected.
Right. Oh, thanks for all of that information. And we can put that on the link, gracefullygraying.com, when we put this interview up on our site, for people to get that information, and your information, everything from the phone number to the link and all of that. So believe it or not, we've run out of time. Some pretty heavy stuff here, but your insight into all of this is really greatly appreciated. So thank you for joining us.
Thank you.
And to all the viewers of Gracefully Graying, again, check out the YouTube interview, search Gracefully Graying on YouTube and visit gracefullygraying.com. And we thank you again, and for all of your service in the community and beyond, and the information that you've provided pertains to anybody, really, no matter where they're located.
Thank you. And I just hope the message gets out there that even though these are difficult times, there is help and there's hope out there for everybody.
Yeah. Okay. Well, thank you, Jeffrey. And Good to talk to you.
Thank you.